All right, good afternoon, everybody, and welcome back to the Lightning Step virtual couch. My name is Benjamin Turner. I am your behavioral health advocate. In this series, we put a spotlight on innovators within behavioral health, and our featured guest today is none other than Lightning Step's own Martin Ignatovski. He has been with us just under a year, and in that time, he has brought to us a number of innovations that have been changing the game in behavioral health and the technology that we use. But before we jump into that, some introductions. Martin, thank you so much for joining us.
Hey, Ben, such a pleasure being here, and honestly, really excited to speak about all the innovative practices and solutions we're really bringing to everybody here. So everybody, my name is Dr. Martin Ignatovski. I've been with Lightning Step, as Ben said, under a year, but that doesn't mean that we couldn't innovate, right? So at the end of the day, what we are trying to do is really bring something in from a perspective that really helps not just clinical users, but every user in the behavioral and mental health industry, and really changes how we operate from a positive perspective. So excited to talk about it today.
Awesome. So am I, man. Thank you so much for joining us. You have brought a number of innovations to us, but the one that we really want to talk about today is Leah. Now, who's Leah?
So Leah is actually a Lightning intelligent assistant, and it's interesting. We actually had a competition for the name, and it came as really an internal suggestion from one of our various team product managers. It stands for Lightning Intelligent Assistant, and the reason is because as we're developing this feature, which is our AI tool to help clinicians, not just with documentation, but with a lot of different things throughout the product. As we were developing this, we had to figure out a name that was really empowering, that had a positive voice, that sounded like an expert in the field, and really guide clinicians and even others in the future, billers. We're seeing a lot of potential innovation of where this is going, to a point that allows us to innovate and add more functionality and features as we go through. So that's Leah. It's our artificial intelligence child, if I may say that, without scaring anyone away from it. But really something we're very proud of and part of our Lightning Step EHR, RCM, and CRM product.
Awesome. And I want to dig deeper into that. But before we jump in, give me a little bit more about your background, and then tell me what inspired you to create Leah.
That's a great question. So first, I've been in healthcare technology for over 20 years. I remember implementing electronic health record systems when everybody used pen and paper to write notes. Try to store them away, try to transfer. So data migrations for us at the time were not from a system to a system, but they were really from paper to a system. So scanning, OCRs, we had to think of all of this. And now 20 years later, what I've learned through just being mostly in the behavioral, mental, and developmental health industry, technology industry, is really the point that we are spending a lot of times in the healthcare industry on administrative tasks. We are really to that point where we just do a lot of documentation. We do a lot of different add-ons that take a lot of our time out. And as I was thinking through this, obviously, I've been throughout this 20 years, I've led product, technology, cybersecurity, and compliance teams. And part of my background includes a PhD in cybersecurity, which actually helped me a little bit when it comes to create Leah and how we really created. And we will talk a little bit about that later. But typically, Leah came out of really listening to our customers. When I came to Lightning Step, and even before that in the industry, people were struggling with administrative tasks. And not just that, the industry, the mental behavioral health industry, saw significant over the last 3 to 4 years increase in demand for services, but the supply remained the same. So you see a lot of clinician burnout. You see a lot of people really spending a lot of time on other things. And I tried to figure out, like, how do I help clinicians when it comes to this? How do they also indirectly help the clients and the patients that they're seeing and they're helping on a daily basis? And how do we start somewhere where we can start introducing incremental improvements across the board? And that's where the Leah idea came from. So literally, we talk to customers. There are several customers and partners we have that we work with throughout this process, and really inspired us to even include more and more and more as we talk about it. So
awesome. Yeah. And I want to get into what customers have been saying about it. But before we get there, tell me a little bit about how Leah differs from other AI tools that are available in the market now.
Yeah, so Leah is really AI assistant right now that people can use for generating notes, for generating utilization reviews, for creating group notes, and that obviously expands going forward, and assessments, treatment plans, and so on and so forth. So with that being said, our tool is fully integrated. And I don't want to talk bad about any other tools or anything like that. Everybody does a pretty decent job. But our tool is truly integrated within our mission of really our product within the Lightning Step platform. So when you look at it, you don't have to go elsewhere, copy paste notes. You don't have to take any sensitive data outside of your system to put somewhere else so you can generate the note so they can save it in their system and train AI to put it back in our system. And just for those who are really techy and want to hear a little more detail, our assistant actually has over 97% accuracy on the content it writes. And there is so-called a hallucination rate, which means how much fluff it adds. It's actually less than 3%, which is one of the best in the industry out there when it comes from a generative AI for generating notes, progress notes, assessment, treatment plans, utilization reviews. It really focuses on what we have that's very specific to our market, to the mental and behavioral health market, and really writes the notes in a way that a clinician within that market space or industry would write. So I really see it as a solution that doesn't just go write text, and it doesn't really create any of this fluff that you need to do. And just to add a little more, and it goes back to your initial question, right? Why Leah? As we were doing this, I was doing research, right? So you have these so-called AI tools that really use auto generation and auto scripting. And there is actually academic research that exists out there saying that a lot of these AI tools or auto scripting tools, right, generate about 60% extra redundancy in a progress note that shouldn't be there. That actually makes the progress note harder for someone to understand the read, having people ignore a lot of it. And that actually impacts and affects care. And interestingly, and as I was thinking through this, I'm like, we have to create something that's very tailored, very specific to the industry, and doesn't just go ahead and create fluff or create different things. It really is very specific to that specific record, to all of those. So that's where it came from, and that's how we really differentiate our tool from anyone else in the market.
Great. So that's the differentiator. Now let's talk about what Leah does. So what specific challenges does Leah aim to solve for providers?
Yeah, so Leah is a tool that looks one way today and is going to have a lot more functionality tomorrow. And I don't even want to talk about the end of the year. There's such a huge vision behind it, right? So start thinking from a vision perspective, or even just a regular task perspective. Let's say you see a client or a group of clients in a group session, right? Any of those. After every session, you have to document that, whether you do insurance billing or not for the care cycle of the client, you have to document all of those things. As you're documenting, there is research actually that shows that in the mental and behavioral health space, it takes on average, this is average, some take less, some take more, between 8 and 15 minutes average to complete a progress note for one individual client session. So if each session takes 8 to 15 minutes, that's a lot of time. If I have 6 clients today, I'm already spending between 48 and 120 minutes, right, on a progress note generation, just writing those notes. So as we were working with Leah, what we wanted to do is not just create something just to be there in the progress note. We want it to be accurate. So Leah can be used in different ways, and really it's so exciting because I even see our customers coming in and using it the way we never first intended to use. So it goes with a component of you enter the data from the session that you capture, whether that's whatever data you capture. You can enter your own data. You can enter bullet points if you want. You can enter just snippets of data where you need to enter within the progress note, whether that is a depth note, SOAP note, or just a simple progress note that you're using. As you enter the data, we take the data and send it back to the assistant on the back end. Leah does all the work and generates a very accurate, as I mentioned with the numbers earlier, progress note that captures pretty well the whole situation within that session, within that note, without the additional redundancy, without the additional fluff, and without really compromising the ethical secure standards that people have, or even security or privacy of the data that is being used there. So right now we're using it for progress note, and that's going to go even further. And I mentioned some customers using it a little differently too sometimes. Some people go ahead and just do the speech-to-text recognition from their browser. So they just take everything that happened in the session, they send it to Leah, Leah still generates that note for them directly within the system without having to really redo anything. So it really has a lot of possibilities. And as we're extending this, there's going to be a lot more added to that, a lot of automation, just with the goal of really saving time for the clinicians when it comes to that. So.
Awesome. Yeah. So a lot of people ask about accuracy and consistency within this. How does Leah ensure accuracy and consistency?
Yeah. So every time we want to use, everyone uses Leah, right? And I see a huge adoption with our customers. It warms my heart because I know we did something to really change the way we operate and make it better, more efficient. So the way we really operate is we use a very high level, high accuracy model that's over, as I mentioned, 97% accurate. What it does is that we understand what our customers do, right? We talk to our customers, we get their feedback, we talk to the industry, we talk to experts, and understand exactly what we do. So when we work with Leah and as we modify and improve, there's always going to be improvements and room for improvements when it comes to technology, right?
Mm-hmm.
We continuously get that feedback and incorporate it within Leah. Leah is very specifically directed to create those notes in a very specific manner. Like, I'll give you an example. Leah might go ahead and say, and we know that there's a specific instruction in Leah that says you cannot use judgmental tone or voice, right? Like, there is a specific way of how we generate those notes that really accurately represent the session that the clinician or the provider had with their client, and really captures it in a way that we have not seen before when it comes to that. So very exciting about how that works. It's very accurate when it comes to it. We do get feedback continuously. We keep training it. We keep working on improving it, and not just improving the functionality, but improving the accuracy and really improving the outcome that our clinicians really get out of it.
And I've seen it in action. It is pretty impressive. I will say that. What I want to ask now is, how does Leah integrate with existing workflows and possibly EHR systems?
Yeah, I mean, it's very easy. I know that sounds very dismissive, which is not. But the way Leah works is that once you have it enabled within the Lightning Step EHR, what happens is that it's on the progress note, whether you use standard or custom note templates, whether you use DAP, SOAP, or Simple, which is the most used right now in the industry. It's very easy. I mean, it doesn't change the workflow. It actually improves the workflow. So as you look at it, I know from a fact from the data that we're seeing, clinicians save anywhere between 5 and 10, 15 minutes per note writing. So as I mentioned earlier, 6 clinicians, 5 minutes, 30 minutes, or 6 clients, 5 minutes, 30 minutes each day. That's a lot of time that you can use for other things as well. So that being said, it's really a button click. You do whatever you need to enter data that you want captured appropriately. And guess what? You just click a button, wait 30 seconds, and the note's there. So
sounds pretty easy to me. Let's talk compliance and tell me about privacy and security. Everybody's concerned about that.
Yeah, I am always careful when it comes to technology, and especially the use of technology in healthcare. And as I was developing and working through this with the team, really understanding how do we do this the right way, it was very important for us to understand, how do we protect the clinician, how do we protect the client that they're seeing, and how do we even protect the system so we don't put data that shouldn't be there, right? And we don't share data we shouldn't share. Because at the end of the day, privacy, security, and even ethical consideration for AI are extremely important. So we wanted to make sure that our AI is explainable. I can tell everybody how our AI tool works. I can provide all the instructions, everything, how it approaches the writing, right? So we can explain how it works. Even the data that we send, when you enter the data in your EHR system in Lightning Step, right, to use Leah, we strip any identifiers of a patient record. Then our generative AI tool takes the data still as a whole and analyzes the whole picture, and then spits out the content back into the system. The generative AI does not retain any of that information for a second longer after it spits out that content. That is it. The generative AI tool doesn't have that content, and we do not even use that content to train that tool on, which is, I know a lot of people say, well, you should. Well, no, we shouldn't, because I want to make sure that privacy and security of the patient is really protected here. There is public data we can use, and that's what we're using for the training of the model and the whole thing. But there is no retention of the data within our generative AI tool when it comes to it. So once the data is being sent, The only place where this data is actually stored is within the Lightning Step system, just like every other piece of data that you have, which is properly secured and HIPAA compliant.
Mm-hmm.
So this tool is actually fully HIPAA compliant, meets all the requirements from a security and privacy perspectives, does not share any of the patient information or client information, really allowing us to create it in such a way that even people who were so hesitant about AI are now saying, you should have functionality for this, you should have functionality for this, you should have functionality here. And we'll talk more about that as we go, but it's really that exciting component of having it done the right way, in an ethical way, because we don't want the data to be shared, not even in a sandbox. I've heard some other AI tools have their own sandbox that I think is protected, which is fine. We don't do that. We really are very careful on how we really approach building it and how we really approach training it and even modifying and instructing it to work within the system.
Okay, and so for any potential customers, you're available to speak with them to ease their minds on these issues as well, correct?
Yes, that is correct. Myself, the product team, and even the customer success managers, we are all ready. I'm very excited because it's transformative, truly transformative when it comes to this, and I cannot tell you the benefit I've heard of seeing over the last just few weeks that people have been using it.
Let's talk about it. You got a success story for me? Anything that you've heard from customers that are using it?
I do. So from initial data, I'm going to go with data points, and then I'm going to go with a little more of the testimonials.
Yeah.
I'm going to paraphrase because I don't remember every single code out there.
We'll allow that.
But just data perspective, even if you take the lowest end that we've had reported from clinicians, that they're saving 5 minutes per notes, that's the lowest end. Again, this is the minimum time you can save with the notes. Add the load that we're seeing within our system, right? And how many notes are being taken, group notes, the whole thing. We are on average saving a clinician between 12 and up to above 12 and a half hours every month if they're a full-time load clinician. Just imagine having extra 12 and a half hours in your day, in your month. That could help with either supply demand, it could help with burnout, it can help with a lot of things. But a lot of clinicians come back and say, oh my God, this is helping so good. I even have a really funny story from one of our customers who said, one of their clinicians said, this tool writes notes better than I ever can. I had people who said, I would never use AI in my life. In the future, they used AI and they came and said, I want AI really for assessments. I want AI for treatment plans. Can you please expand the functionality so we can actually continue using it more? Especially when you talk, right, as we talked about the ethical background, the security, the privacy, and really all the benefits that we're getting out of it. And the beauty is I had clinicians saying, I can increase now patient load, and help really with the supply and demand issue in the industry in general. Others say, I don't want to focus on necessarily a patient load increase. I want to keep the same load, but I want to use that extra time to spend more time with my family. So I don't burn out. Think about a lot of these high turnover rates that behavioral health companies have today from a clinician perspective. This is the tool that really helps them increase the satisfaction of the providers and the clinicians to really allow them to stay there. And then finally, I'll share one more example where one came to me and said, I don't care about clinician load. I don't care about saving more time, extra time for me to spend with my family because I already have that. I have a good work-life balance. What I want to use this time for is really focus on the client more so I can understand their problems, so I can provide better planning, better treatment options, so I can really improve the patient outcomes or client outcomes in that situation that are really going to help and make a difference of what I really want to do on a daily basis. So really exciting. I mean, there's so many of those that we get every day, literally every minute. I get some feedback on those, and every time I want to start crying with how good those are. So
I love hearing success stories like that as well. And it's true, the number one factor we've found for staff burnout is clinical documentation and the load that it takes to complete that. So a tool like this, I can see just taking a huge load off of those folks. And I, my first thought is giving more time back to their families. I think that is such a stress reliever if they're allowed to do that and have the time to do that. So let's talk about getting it. Let's existing customers have the ability to have a 30-day trial. Is that correct?
Existing and new customers. So everybody gets the ability to have a 30-day free trial, no obligation if they don't want to use it again. I have not seen anyone opt out yet, luckily. Talks about the success of Leah really and how accurate and good it is and how it really helps clinicians overall. But it's really 30 days free trial for all existing customers. So all they need to do is really reach out to their customer success manager or to support. Just open a real quick ticket in your help center and say, I want to try Leah, and we'll enable it to you within 24 hours or less. So we're excited to hear from you. Really, the more people who use it, the more impact we can make in the industry and really in providing care overall. And I'm really excited for that. But to that point, also new customers can use this. Whether you're not a Lightning Step customer, you can always consider the Lightning Step platform, because we are powering it with tools that really help clinicians on a daily basis. And not just clinicians, even billers. Think about AI with billers and how we can do a lot of different things within the system that are going to help create the system to be more efficient when it comes to billing as well. So those also can get it as part of the purchase of Lightning Step and use the Leah tool as well. And we're also willing to demo a lot, so we can.
Yeah, exactly. Are there resources and support available for people that are trying it out for the first time? They're not sure how to use it. What resources and support can you speak of?
Yeah, so we do very interactive sessions. So we can either get on a call with our customers and explain how to use it. It's very straightforward. It takes less than 6 minutes to show and generate a note at the same time. Explain and generate a note. So imagine how quick it is on the note generation. We have videos, explainer videos that people can use, and we even have written directions, whatever people prefer from a learning style or perspective. It's very simple. It's extremely easy to use when it comes to that. But we have our customer support, customer success, even our product team standing available to really help with this.
How do you see AI tools like Leah shaping the future of behavioral healthcare documentation?
I see it more than just documentation.
Yeah.
So, and that's a great question, right? A lot of generative AI around documentation, but AI is more than documentation, right? It's more than just generative text. So while this is actually one of the biggest pain points, this is why we started here, because everybody's biggest pain point is here. Think about a holistic picture of a system. I'll give you just one example of what one of my customers said that their biggest problem is. Think about just a regular outpatient client lifecycle. Someone comes in for therapy, right? Talks to a clinician, whether that's telehealth or in person. They leave. So now the clinician has to go ahead and document everything. The biller has to go ahead and do the whole situation together, make sure that they remember, put something in, not forget, right? The whole thing has to be in a process. Think about Lightning Step a few months, and as we progress our AI tool here, going into a direction where you go, let's say you have a telehealth session. Now I can have a whole client summary before that on my calendar link generated with our AI tool, but using just the data, not extra data, using the data for that specific client of every encounter, everything that you've had in the past, giving you that summary before the session so you as a clinician are more prepared to it. Think about Leah now being able, you have that summary, which takes a few minutes to read, prepares you better for that outcome, to get better outcomes out of that session. Now, let's imagine you're going to a telehealth session, group or not. Doesn't matter, right? And then imagine the telehealth session now does speech-to-text transcription in an automated way and pre-populates your progress note. So all you need to do is review the progress note to make sure that it's accurate, and it's already there. So you don't have to open anything. It's just you go and check everything that you have on your task list. And then as you do that, imagine that if this is an insurance and copay, it automatically allocates the insurance and the copay with authorizations, and it automatically submits claims for you. So you don't have to even think about any of this. So that's where the future is going with our tools. But there is even more than that. And I'm just going to touch briefly on it. I just want to get people a little, I'm very excited about this. I don't know if you can tell. But I want to just introduce of what might come here in the future, because this is going to keep iterating. We're not going to stop here. This is not one and done for us, right? We want to really transform the behavioral health industry, and this is the way to do it. So think about now, if I'm a clinician or if I'm a practice or if I'm a bigger multiple facility institution, right? Maybe now I want to make sure that I start matching my clients or client inquiries with the appropriate provider or clinician. Now think about what we can do with machine learning as well, which is part of the bigger AI component, and just being able to say certain clinicians have way better outcomes with this one. That doesn't mean that others are not good. They are good for other type. So when you have all these details for a certain client, then you can do proper matching to get the best outcomes. So when you provide care at the end of the day, you know exactly the outcomes. One of the biggest concerns, and people keep saying this, I know how long it takes to heal a broken arm, but I don't know how long it takes to heal depression or anything, anxiety, right? Well, guess what? The moment you start having this data, then you can have predictive analytics that can help you really understand what could be the discharge date. Well, there's a lot of things that we can do, and I don't want to go into all of that, but that's all on the roadmap. Really working towards that in the next year, and really making sure that our clinicians are served the right way, and that they can serve the patients and the clients that they see on a daily basis in a way that it's so easy for them.
That's awesome. It's such exciting stuff. And I know anybody listening to this is going to be just as excited as well for the future and for what's available today. You talked a little bit about patient outcomes, provider satisfaction. Let's go on to system requirements. What's required for implementing LIA in a practice?
Really, just Lightning Step.
That's it. Yeah.
Like, there is no additional requirements. It doesn't take anything extra. We're not asking you to buy equipment. We're not asking you to do anything. All you need to do is have Lightning Step electronic health record system with RCM and CRM if you want to, and just enable LIA.
Okay. Hey, that sounds simple enough. I've spent some time in Lightning Step. I think it's a pretty good platform. So a little partial maybe, but I think it's well built in there. Let's move forward a little bit. So we got a 30-day trial. What happens after 30 days? What's the price like? What are we talking a little bit about?
Yeah, so typically we have a list price, obviously, and depending on the number of users, that price is adjustable as we talk through it. But typically after the 30-day trial, we work with our customers to really ensure that they understand that we have a certain price structure in place. We actually tell our customers beforehand. Because look, there is a cost to process this data, to do all of this. So we have to introduce that to our customers as well. But the ROI actually on that price, whatever that price is determined, there is a certain range that we're determining a price in, very little range. But whatever we determine there, the ROI is significant when it comes to this. Just think about the minimum saving time of 12 hours for a full-time local clinician and what you get back. Just seeing one more client pays for the future for several months. Typically, our sale price right now goes about $35 per user per month, but reaching out to us, we can work something out.
Yeah, you guys will work with them for their needs and meet what they need to. Understandable, but there is a pricing structure that works with that. Yep. So LIA, it's phenomenal. It does everything. Yeah, but let's be realistic. What are some of the limitations, if there are any? What are the limitations or situations where LIA may not be suitable?
I don't see a lot other than where we've put LIA right now. So the challenge for us is trying to do this quick enough to put it everywhere in the product and really integrate the AI components everywhere in the product. Right now with LIA, people can generate notes. People can very soon enough, start generating assessments, working on treatment plans. So all of that is already almost done. Some of that is already working, obviously. So right now, for example, LIA won't be able to give you what I mentioned earlier, the summary, right, or the speech to text, but that's also on the roadmap. So if you're talking limitations from that perspective, there is those limitations that it's not implemented everywhere. It takes some time for us to even work. And going back to our ethical development, making sure that we do it the right way. We don't just slap something somewhere and we call it AI. This is great, even though it creates terrible results, right? I've seen demos, and though I know how demos work. And I'll put the content of LIA with anyone else out there. So that being said, really from a progress note and documentation perspective, there's no limitations to what LIA can do, how it can get it done. Yeah. It's really just how quickly and how good can we position it in the rest of the product.
That makes sense. So let's talk a little bit about Lightning Step itself. What sets Lightning Step apart as a company in terms of commitment to innovation and customer support?
I came from another organization where we cared about our customers. And I said, I will never, ever go again because of my past experiences to an organization that doesn't care about its customers and the mission is just on paper. Lightning Step has never been that since I joined. And this is one of the reasons why I joined here, is really the focus on the industry. That's number one, obviously. For me, it was always on what do I need to do, right? Everybody's asking themselves the question, what do I need to do to make our users' lives easier? Think about this. When you're handling product, just like we are here at Lightning Step, a lot of people want you to spend more time in the product. They want you to be there. I actually want the complete opposite.
Yeah.
And that's what we're going and where we're going with Lightning Step is I want our users to spend the least amount of time in our product, but complete all of their work that they need to complete in that minimal amount of time. And that's where we start. So you have a fully integrated EHR, RCM, CRM, and now AI-powered solution that's going to have more integrations and products and releases over the next several months that are very exciting. I can't speak yet about them. But and then as we go through that, it's not just fully integrated. It's powered actually by a team of people who truly care. I mean, my team and I, every day, we have one question we ask ourselves: is today what I'm doing right for my customer or not? And if the answer is not, then why the hell are we even thinking about this? Yeah. So that's where we're coming from. That's really our mission. And a lot of our personal missions actually align with the organizational mission to really transform the industry.
I appreciate all of this information. It's blowing my mind, and I'm sure it's blowing everybody else's that's listening. I know our customers are so thrilled with it. Everybody that I've talked to just can't get enough of it. Like you said, they're asking for more. We've even turned people that were so anti-AI into true believers. So I really appreciate your time. Is there anything else you want to add before we wrap up here, Doc, that you really want to get across?
All I want to say is give Leah a chance. Try it out. You don't have to commit to anything. Try Leah out. It will change your life. It will change your perspective on how it's done.
Yeah, absolutely. And give us a call. Reach out to your your territory manager or whoever at Lightning Step. We'll get you a demo. We'll set you up some time, even if it's just to show you the Leah platform and how it works. But I think you'll love the whole system once we get you in there. So, Dr. Martin Ignatovski, again, thank you so much for your time. I'm so excited for the future at Lightning Step, and I really, really appreciate just chatting with you today.
Ben, thank you so much, and I appreciate your time as well.
All right. Thank you so much.
All right, bye.